Hi everyone, and welcome to our November edition of web series. And today's November 1st, 2017. As you guys know, that we collect that information, we collect questions that interest our patients or our viewers, and we talk about those questions. And this last month, we had a lot of questions regarding MRA. And we're going to talk about who needs to get this procedure done, the way it's done, and also we're going to show you some pictures so you guys will have better idea. And I'm going to have Andre start off by explaining some information, give us some information about the MRA.
Sure. Hi everybody. So MRA, right? We all know that MRI stands for magnetic resonance imaging. MRA is a part of an MRI test that is the study of the arteries. Hence the A at the end of the MRA stands for angiogram, the study of the arteries and the vessels. The way we do this test is basically two things happen. We have to do an IV injection of this fluid, which is called gadolinium. That basically goes everywhere, wherever your blood goes. And depending if we're doing the brain, or we're doing the neck, if we're doing the abdomen, or even the
Legs.
Lower legs, the timing is different as to when we catch that injection. Also, the second thing that comes in, it's a specific MRI software that we use. What it does, it suppresses all the other signal in your body. Let's say if you're doing the abdomen, we want to see the aorta. It will get rid of all the colon. It will get rid of all the kidneys and
solid organs, livers and stuff.
All the soft tissue and solid organs. So all is remaining is the vessel, the artery itself. The test is very non-invasive as compared to the regular angiogram that we all know, how they have to go through your leg, and it's a procedure room.
Put you under anesthesia.
Yeah, there's a lot of invasive stuff that's involved. So this is where the MRA comes in, and a lot of physicians prefer the MRA as opposed to the regular angiogram. And like I said, that could be done at any part of the body, and average scan time is only about 30 seconds. The injection itself is very safe. It doesn't harm the patient. There's no weird feelings during the injection. Patient doesn't even know that there's anything going on. And as far as the patient is concerned, they don't even know if it's an MRI or an MRA. But if you guys hear an MRA, that means the study only for the arteries. Now, why do we do an MRA? What's the reason? Why do doctors order it? Rubik.
Sure. There's a handful of people that can have this kind of MRA procedure done. For instance, we do brain MRA, which is COW, C-O-W, Circle of Willis. It has multiple names. We do it when we suspect aneurysm, brain aneurysm, which means dilation of the vessels that can cause a major problem. So with MRA, it's very easily diagnosed and very easily treated. Second study, like I'm just kind of going down from top to bottom. Second is going to be MRA of the carotids. Again, this one is done with contrast, like Andre said. We look at those, we do those again for, I think, can be for two reasons. One is aneurysm, dilation of the carotid, and the opposite of it, which is the arteriosclerosis, narrowing of the arteries. So for both reasons, we can do MRA and see if it's dilated or it's narrowed down. And the next one is going to be MRA of the abdomen, which we can rule out aortic aneurysm. Some of you are familiar with AAA, abdominal aortic aneurysm. Again, in this case, it's a very dangerous situation when the aorta dilates and it can rupture, and it's a dangerous situation.
Basically, if it can burst. So
yeah, if
it becomes bursts, a very urgent.
It's a fatal situation. So with MRA is very easily, I mean, like Andre said, 30 minutes, you can rule out and find out if actually you have an aortic aneurysm or not. And finally, we do runoff. Runoff is a very interesting study. Again, injection. And the timing is completely different, like you said, than the head, neck, or the abdomen. It gives you the small, tiniest vessels and the arteries of your legs, starting from hip all the way down to the toes. And again, that gives you a lot of information. Again, aneurysm, it tells you if the vessel is dilated, or arteriosclerosis, if the artery is narrowed.
Right.
If the inside is narrowed down.
I wanted to add two more important things to the why we do this study. One important reason we do this, let's say somebody's blood pressure is not controlled, it's extremely high. That means the arteries in the kidneys are not working
arteries,
properly.
Absolutely.
Either they're narrowed or the flow is not working well. So we do an MRA of either the kidneys or the abdominal aorta,
which is exactly.
And we see if those arteries are not functioning properly, they're not taking the proper amount of blood to the kidneys, the blood pressure will be an issue. And what will happen is you'll see, with medication you can't control it. It keeps going higher and higher, higher. So there's another reason, another underlying reason, which could be the kidneys. That's a very common reason that we do
high
MRA.
blood pressure. That's first thing they look at is that when there is an uncontrolled high blood pressure, first thing they look at is the renal arteries, and one of the only ways actually to see it is the MRA that you said.
Or an angiogram, but routinely they're not going to do an angiogram just to make sure your kidney vessels are not functioning properly. And another important one, when we think about strokes, right? How is the blood going from the heart to the head? Are the vessels open in the neck? Is there maybe a small blood clot, or is there narrowing going on? That's why we do the carotid study and the study of the head to make sure that that blood flow from heart to head is what it's supposed to be.
Most of the time, those two are ordered together: the carotid of the MRA and brain MRA. The
it can be. Patients, when it comes to the patients, it's basically the most important thing is them not moving during the scan. And just with any other MRIs, motion is the number one enemy of imaging completely. It doesn't have to be CT or MR. And this makes it all that crucial because we only get one shot to do the injection and catch that fluid at the proper location at the proper time.
Yep.
So we need to work. It's very important
timing.
to educate your patients to know what to experience. When the table is moving, what to do, when the dye is going in, what not to do, and so on. But it's a very common test, MRAs, that we do. It's probably about 10-20% of all the MRAs that is done, all the vascular stuff. So if you hear an MRA, that's what it is, basically a study of your arteries and your vessels.
Yep.
Should we show some images as to exactly what they look like?
Why not?
Okay.
The first picture that we're going to show you is the brain MRA, the cow, circular Willis.
COW. It's got a funny name.
As you see that all those highlighted areas, those are the vessels and the arteries. And it's very easy. If there is narrowing, you're going to see a break on that bright area. So that's how the doctor knows, or radiologist knows, that it is narrowing. Or you're going to see like bloom-like area in one of those vessels that you see on the screen. That's an aneurysm.
You know why it's called circular Willis? If you pay attention, all the arteries in the middle come and form a circle.
They say 50% of population have it complete
Different
circle,
variety, yes.
and the other 50 that has a cut somewhere.
Yeah.
So we don't know which one is better than
Right. Let's move on to number two.
Yeah, number two is going to be the carotid MRA.
Neck. Yeah.
Neck carotid. So it's the same thing, exact same thing. If you see, you want to see nice, bright, straight arteries, no breaks in between, no dark areas inside of the arteries and vessels.
It's important because, as you can notice, it connects the heart from the bottom portion to the brain.
Exactly.
So this is a very common and very important test to do.
And the third one is the renal artery MRA.
We spoke about hypertension. We spoke about AAA. So, and also abdominal aorta, as you can see, it's the biggest artery in your body. So the flow in that is just amazingly fast.
And comes out of the heart, goes all the way down to your vessels, and separates and supplies blood to the rest of your legs, or both, or your legs, rest of the body, I should say.
So it goes to your groin from this picture, and the very last one we want to show is number 4, which is also can be referred to MRA runoff, which is basically the study from the kidneys all the way down to the feet. We actually perform a lot of those here, and with great success and with great image quality.
It's an amazing study.
Let's say some patients are diabetic. They're unable to have iodine injection when they go to angiogram. When patient is having an angiogram, a routine angiogram, they inject iodine. If the patient's diabetes is very high, then
Kidneys
that's
are not
very,
gonna-
very
yep,
dangerous
kidney
to
failure.
shut their kidneys. This is where MRI and even MRI basically comes in.
Perfect.
So,
Before we finish, I have a question for Andre. I
Yeah.
know you're a big-time Dodger fan.
yes.
You think they're going to take it today, World Series Game 7?
Oh, that's not even a question.
I like that.
We're going to celebrate today, LA, Dodgers.
Go Dodgers.
Can't wait for a couple of more hours, guys.
There we go. Thank you so much.
That's it for today.
Be healthy.